I've had the privilege of working in Cornwall since 1982, so that's 38 years, and I've been working within the hospices since 1993. And what I can remember in my working life is a time where people were frightened to die. People did not die well. They were distressed and not well symptom controlled. And the hospices were in existence, or Mount Edgecombe was in existence when I was working in the acute hospital, but St Julia's wasn't. But it was very evolutionary. It was kind of fantastic that people saw the vision and saw that it was needed in Cornwall, sitting on the back of cancer care. But what's happened in the 27 years that I've been in Cornwall Hospice Care is we've gone from two separate units. Mount Edgecombe had lots of beds and was fully operational at the time that I came in 1993, but St Julia's had been being run as 4 beds in a balcony in St Michael's Hospital. And when I started at St Julia's, I was paid to do 4 sessions a week, and I was taking over from GPs popping in and out on top of their normal working day to look after patients that they thought would be well nursed and cared for in the hospice beds. And what has actually happened is that the support and care that's available for patients has grown enormously. When I started, I was being paid to do 4 sessions a week, but I was actually on call 24 hours a day, 7 days a week. And the only time I wasn't on call was the 3 weeks in the summer when I went on holiday and they got a doctor to come from London to be my locum. And so that isn't a sustainable way of working. That isn't the way that anybody can live and work without end, and particularly when you think about the kind of people that we're looking after. So the push to manage the clinical resource, which is of course the expensive resource, but is the bit that everybody sees in hospices, was there. And it's been fantastic that the services merged initially clinically and then merged formally, St Julia's and Mount Edgecombe, into Cornwall Hospice Care. Because what we've now got is a service that supports 2 units at different ends of the county, and that is really important because the geography of Cornwall and thinking about people travelling at a time of great distress for themselves as patients and their families and all those who love them mean that we do need to be care as local and as close to home as possible. But what's also happened in that time is that the culture has changed completely. So talking about death is something that is much more open now than it was 40 years ago. What we're trying to do is meet what people want. And so for people to say what they want, they have to talk about what they want, and then we think about what they need and how we best look after that. So we now know, and the culture has changed completely, that, if everybody had the choice, they'd like to be at home. But if they couldn't be at home, their second choice is to be in a hospice. We know that when people die in other care settings, it isn't as good as we would all hope it would be for them all the time. And so the hospices have developed this role, Cornwall Hospice Care has developed this role, where we're supporting and working collaboratively with the acute hospital, with community services. We're providing expertise so that we're touching and making a difference to more than the people that we just look after in our services. And that's really important because what we do as an organisation is far bigger than any numbers or hard statistics will tell us. And that shifting of culture and the thought process is that everybody's entitled to a good death, and that principle of looking after somebody as you'd want to be looked after yourself, or one of yours to be looked after in that situation, is something that hospices have particularly brought to the front in terms of healthcare agenda.